Welcome back. It is your feel-good breakfast show on a Tuesday morning, Expresso on SABC3. On a Medical Tuesday, we're chatting to Dr. Darren Green, who joins us after a month or so of absence.
Yes.
And we're talking about the possible dangers that excessive use of your cell phone can have on your health. And one thing that we referred to early on, but I really do want to rehash on it again, is carpal tunnel syndrome, something that most of us have heard of, but don't really know what it is. So if you can help us.
Yes, so basically there is a sheath that encapsulates at the level of the wrist. Basically, on the inner aspect of your wrist, there's a sheath that covers tendons and a specific nerve called the median nerve that runs in between that sheath. And what happens is there are many different conditions that cause pressure to build up in that space. Either things growing from the outside that can then put pressure on that sheath and compress the nerve, or you can have the tendons themselves starting to swell. And then the other problem is obviously the nerve issues with conductivity and so forth. Now, there are associations with metabolic conditions like thyroid disease. So people that suffer from an abnormal thyroid level might have carpal tunnel syndrome. Also an increased incidence in pregnancy, for example. And then obviously the rest of them are associated with mechanical work and what you're doing every day in terms of typing, overuse, etc. So the good news is there's relief. There's treatment for it, and after using conservative management like night splints to rest your wrists when you sleep, for example, at night, you could look at surgeries where they actually release the tunnel and create more space and release that pressure. But it can be debilitating. You drop things from your hand, and we use what's called the Phelan test and so forth to diagnose it, where you ask someone to actually flex their hand and then push the wrist downwards. Or you can turn your arm that way and pull the wrist upwards. And the sharp shooting pain, a stabbing pain, then radiates down your arm and actually renders your hand weak. And that's quite debilitating.
Now, as always, when we engage in these topics, we do open up our lines for you to call us and give us your questions or comments on 083 9133 728. Marcel joins us on the line this morning. Good morning, Marcel.
Hi, good morning.
Thank you so much for the call. Now, what is your comment or your question to Dr. Darren?
Hi, doctor. I want to know, I had my carpal tunnels released a couple of years back, but because of using my cell phone, I use my thumb, and it's my left arm. It's like an electric shock that goes through your arm for a certain period, like I'll say 2 seconds, and then it goes away and it comes back again. Could that be from using the cell phone?
Yeah, so she describes a sharp electric sensation radiating either from the hand down the arm or from the arm to the hand. Interesting to note that that could be obviously a local compression site of a nerve at the level of the wrist or elbow, but also once we've excluded that, you also need to have a look at the roots as they exit from the neck. So one would certainly examine her systemically and go and look at the levels of sensory fallout and motor fallout of muscle function, and then map out where exactly that compression possibly is. And then you can prove it with nerve conduction studies, which neurologists do.
Now, just quickly, just to touch on this, it's not just cell phone usage, but I mean, for instance, I'm a big gamer. I like to play my FIFA. People that work on laptops quite a lot, or on typing devices that, you are stuck 100%. For a couple of hours doing this. So these are also things to watch out for.
Repetitive motion, fine motor that requires those fine-tuned movements involving the wrist and fingers.
Well, thank you very much for joining us, Doctor. We will return back to this topic a little bit later on. Of course, 083 9133 728 is where you can call us and give us your questions or your comments right now. Let's head on over to the kitchen. I think I smell something cooking and it's delicious.